Have you ever observed that your legs are weakening after the age of 60? To get on your feet, you must push off your knees. Stair mountaineering is much like lifting weights. Additionally, you occasionally lose your equilibrium while clearly crossing the residing room. Most humans expect that this is truly getting old. Here's the reality though. In truth, it is one of the earliest signs of age-associated muscle loss or sarcopenia. It additionally takes area in silence, no discomfort, absence of edema until you eventually want assistance getting out of a chair. Here's the good information though. It has been validated that leg strength can be restored in a depend of days with the assist of just 3 important vitamins. No strenuous exercise, no high-priced remedy, just the right vitamins at the appropriate moment. This video explains the 3 vital vitamins that each senior requires, how deficiencies purpose susceptible, heavy legs, and a way to effectively and correctly blend them for a quick healing. This is not health gossip or hearsay. Clinical investigations, real research, and many years of professional experience guide it. Stay with me through to the very finish. I'll additionally show you a diet routine that most human beings don't follow, but it is pretty effective. Your frame undergoes a gradual, however, sizable change. After the age of 60, your bones start to break more effortlessly. Your blood waft slows down, and additionally, your muscles start to weaken, especially those in your legs. The majority of individuals are unaware that the legs generally experience the preliminary weakness, making even easy responsibilities like status up or on foot hard. Even if they're ingesting generally and feeling quality, folks over 60 lose 1 to a few percent of their muscular tissues 12 months, in line with the American Geriatric Society. This implies that you won't even be aware about dropping up to 15% of your leg electricity in just 5 years. So why does this arise? There are 3 number 1 causes. 1. Vitamin deficits are the primary purpose. Our guts soak up nutrients much less efficiently as we age, and our stomachs create less acid. Low amounts of nutrients, D, B12, and bone end result from this. All of that are essential for nerve transmission and muscular contraction. 2. Poor blood movement is the second purpose. Your legs obtain much less oxygen and nutrients while your circulation is slower. The final results: early weariness, frequent cramps, and heavy, exhausted legs. 3. The third purpose is less physical interest. Leg muscle mass finally weaken and reduce because of elderly on foot much less, or keeping off stairs. Additionally, muscle tissues cannot completely regenerate without the perfect nutrition, in spite of normal motion. The proper news is that you may repair your leg electricity in a count of days by means of resupplying these 3 poor nutrients. Now let's see every nutrition and element and find out how it functions, beginning with the one that maximum aged humans don't take. The switch that reactivates leg strength is vitamin D3. Vitamin D3 is more than simply any other diet. Did you recognize that it reactivates your complete neurological, skeletal, and muscular gadget, functioning extra like a master transfer? This is wherein the difficulty lies. Your frame's capability to provide this vital nutrient declines appreciably after the age of 60. Your pores and skin receives thinner, your liver, kidneys, and conversion of vitamin D gradual down as you spend less time within the solar. Your body consequently starts to shut down critical systems. Your muscle groups weaken, your legs are heavy, you circulate slowly, and most worryingly, you start to lose your equilibrium because you are subtly poor in diet D3, a simple requirement. What makes nutrition D3 so important? Calcium absorption is aided by using nutrition D3, which is vital for healthful, strong bones. However, this is most effective to begin. Additionally, it guarantees that your muscle fibers agreement efficiently facilitates the easy transmission of records by means of your nerves and specifically avoids muscle atrophy, which occurs subtly as we age. When you don't have sufficient D3, your body will become unreliable and susceptible, like the luggage of an old machine. How can you determine if you are poor in vitamin D3? Signs and compass. Weak spot for your legs, especially while hiking stairs. Exhaustion from standing or strolling. Leg cramps at night. Problem turning or stepping unexpectedly. Excessive ache in your hips, knees, or heels. Some people may additionally experience minor anxiety, impatience, and trouble falling asleep at night. These slight signs and symptoms are in reality early indicators of vitamin D3 inadequacy, yet they may be from time to time confused with getting older. What is the clinical consensus? Researchers from the University of Birmingham in the United Kingdom checked out humans over 65. After consuming 800 IU of nutrition D3 for just 5 days, contributors' leg strength extended via a median of 19%. In just a few weeks, seniors who took a D3 supplement and engaged in little workout showed a considerable improvement in their leg energy and balance, in keeping with some other Chinese have a look at. Additionally, researchers at Harvard's Geriatric Studies Middle discovered that older humans with low diet D3 tiers have been 40% more likely to fall or be admitted to the hospital than those with normal D3 ranges. It's an obvious message. Vitamin D3 safeguards your independence, in addition on your bone shape. How does it operate? Your frame absorbs calcium more efficiently, promotes the improvement of latest muscle fibers, enhances muscle contraction and reaction time, lowers latent infection and muscle tissues, and allows painless, smoother motion whilst your D3 stages are back to every day. Simply stated, Nutrition D3 turns on your joints and muscles again. What is the endorsed dosage for wholesome individuals over 60? Specialists suggest 800 to 1 Torivriger international devices daily, 1,500 to 2,000 IU, in keeping with day for humans who have a history of falls or who exhibit apparent signs of frailty. For ultimate absorption, take Nutrition D3 under scientific supervision within the morning or early afternoon and constantly after a meal that consists of healthy fats like salmon, eggs, or olive oil. D3 have to by no means be used right earlier than mattress, due to the fact it can reason sleep disturbances. Is meal sufficient for you? Regretfully, now not without issue. Let's examine the figures. About 500 IU are located in a 100-grain meal of fish. You handiest get 40 IU from 1 egg. There are about 100 IU in a glass of fortified milk. It would be unrealistic for most seniors to eat fatty fish, eggs, and milk each day in an effort to obtain 1 Torr international devices from meals on my own. For this cause, taking diet D3 supplements is frequently necessary. Who must right now reflect on consideration on using dietary supplements? Nutrition D3 must be your essential priority if you are over 60, spend little time outside, feel unsteady, or have fallen within the past, have osteoporosis or joint discomfort, or consume a plant primarily based diet low in dairy and fish. A few important warnings. Although D3 is normally innocent, excessive use over an extended period of time can cause problems. Long-term usage of extra than 4 IU in step with day might cause headaches, constipation or nausea, kidney stones from elevated calcium levels, or bizarre heartbeats in touchy people. This is the essential element. Use the right dosage at the appropriate time and preserve a everyday test for your ranges. The key to supporting older parents restore their leg electricity is Nutrition D3. Your muscle systems, which have subtly bogged down over the years, are reactivated by way of this transfer. If taken well, you can see a difference in some days, such as more potent legs, lighter steps, and increased self-assurance in every motion. Balance, nerve fitness, and leg confidence are all restored with the aid of vitamin B12. Let's speak Nutrition B12. That is one of the most important, yet regularly overlooked, dietary supplements for people over 60. B12, as you can understand, is a vitamin that aids in memory and vitality. However, maximum people are ignorant of this. B12 is vital for the verbal exchange among your brain and muscle tissues, especially your legs. It facilitates you maintain healthful nerves, coordinated motions, and short reflexes. The link among your brain and muscle groups turns into hazy whilst your B12 ranges fall, and your decreased frame is frequently in which the initial signs appear. What takes place in case your B12 stages are low? You may experience signs along with burning, tingling, or numbness for your feet, weakness on your legs mainly while status or strolling, a feeling that your legs are not listening or are asleep, trouble balancing even on level ground, feeling unsteady or the want for assistance when walking if your B12 ranges are under greatest. Additionally, a few human beings be afflicted by temper swings, slight unhappiness, forgetfulness, and mind fog. These signs often seem step by step. A lot of seniors assume they are sincerely developing older. However, they're genuinely the classic signs and symptoms of a B12 shortage. Why is deficiency extra common among seniors? There are primary causes. 1. Inadequate absorption. Our stomachs create less acid as we age, especially in case you take drugs that lower stomach acid, inclusive of ranitidine or omeprazole. It is more tough to get B12 from food on this low acid surroundings. 2. Second, restricted food plan. Meat, fish, eggs, and dairy products are almost the only sources of vitamin B12. You're greater vulnerable if you eat less meat or devour a food regimen strong in plants. Your frame might not absorb sufficient, even in case you consume a wholesome eating regimen. This explains why B12 insufficiency is so everyday in humans over 60. What is the clinical consensus? Numerous research have established the impact of inadequate B12 on older human beings' mobility. According to a look at from Oxford University within the United Kingdom, seniors 65 and older who had low B12 levels walked more slowly, had a ways worse balance, and have been more than twice as possibly to fall in the imminent YR as those with everyday degrees. Journal of Gerontology Clinical Trial. Seniors have been given 1 to 0 mg of vitamin B12 in step with day for 8 weeks as part of a randomized research. Following supplementation, members said less numbness and instability, better decreased body power, and faster reaction instances. In addition to supporting you watched extra certainly, B12 keeps your frame balanced and under control. How diet B12 features within the body. Vitamin B12 promotes the formation of the protective sheath that surrounds your nerves. Red blood cell production, better oxygen delivered to muscles, electricity metabolism, and brief particular indicators from the brain to muscle mass are all made viable by this. Thus, muscle tissue acquire the power they require to feature. Your nerves malfunction, your muscle tissues misunderstand orders, and your legs begin to experience unconnected when you are deficient in B12. B12 insufficiency is most possibly to affect who? If you are over 60, you are more likely to have low B12. Regularly use antacids or acid blockers. Adopt a low-meat or vegetarian weight loss plan. Take metformin and feature diabetes. Suffer from digestive disorders, which include gastritis or IBS. Regularly devour alcohol or have passed through weight reduction or gastrointestinal surgical operation. It's worthwhile to do a quick blood check to decide your B12 stages if this describes you. Indicators that are frequently overlooked. Some folks may not experience the typical tingling or numbness. Instead, they end up awkward or drop gadgets, moderate headaches, exhaustion that doesn't leave with rest. Their feet are experiencing sporadic pains or humming. All of those are warning signs and symptoms that your body is attempting to speak. Additionally, you get better more quickly in case you act sooner. What is the advocated dosage of B12? A day-by-day dosage of 500 to 1.0 milligrams of methylcobalamin is safe and powerful for folks over 60. Methylcobalamin. Why? Your frame can use it immediately without changing it because it's miles the energetic form of diet B12. Seniors will especially gain from this as conversion quotes lower with age. It is available in a lot of paperwork such as chewables, sprays, sublingual pills, and dissolves under the tongue. As espresso and tea can interfere with absorption, it's miles exceptional to take it in the morning or with lunch. Can consuming by myself offer you with enough? Yes, in precept. In fact, even though it's far unbelievable, this is the amount of B12 discovered in common meals. 3 Oz of red meat liver around 70 mg. 3 ounces of salmon around 4-5 mg. 1 big egg, merely 0. It's 1 cup of milk, round 1 millig. To meet your demands, you will therefore need to eat numerous fish and dairy products or liver each day. The extra sensible desire for the majority of seniors is a supplement. Is it stable? B12 is soluble in water. This shows that any excess is flushed from your body. Even at excessive dosages, it is very safe. In wholesome people, there is no known lethal quantity of B12. However, if you are on blood thinners or have chronic renal problems, please see your medical doctor. Otherwise, B12 dietary supplements are among the safest and maximum efficient approaches to growth electricity, enhance nerve function, and regain manage over one's legs for the majority of human beings. True testimonies, actual effect. Thanks to a nutrition that maximum of us neglect, many older folks document feeling greater constant whilst on foot, regaining sensation of their toes, standing up more with a bit of luck, and even drowsing better once their nerve symptoms subside. Vitamin B12 is a motion nutrition as well as a mind diet. It reestablishes the connection between your body and brain, and your legs feel more potent, your muscle mass react extra quick, and your confidence comes returned while those traces are clear. Don't brush aside it if you've been experiencing unusual sensations, limb weakness, or balance issues. Examine your B12 and give your nerves what they have been yearning for. Diet Bone, the name of the game of anti-fatigue and muscle electricity. You are likely aware of how vitamin D3 allows to build muscle and how nutrition B12 facilitates nerve-to-leg communication. However, the puzzle nevertheless has one extra piece, and this is thiamine, some other name for nutrition bone. Vitamin bone offers the energy or the actual energy your muscle tissue require to transport. If D3 turns on the lighting fixtures and B12 hyperlinks the strains, your muscular tissues just can't work without it. Without bone, your frame runs out of gasoline, even in case your bones are robust and your nerves are sharp. Vitamin bone, what's it and why does it remember a lot? Diet bone, regularly referred to as thiamine, is important for energy metabolism. This indicates that it aids inside the conversion of food, especially carbs, into ATP, which is useful electricity. Every movement, every breath, each muscular contraction is powered by means of ATP. Additionally, given that your legs are the biggest muscle tissue on your body, they need a constant supply. Your muscle mass feel heavy, fatigue effortlessly, and recover poorly from any movement, whilst your bone density is low. Symptoms of a probable nutrition bone deficiency. Many humans over 60 describe these early signs. Even with little activity, legs experience weak or extraordinarily exhausted, cramping inside the muscle groups, mainly within the FT or calves. A dragging, heavy feeling while transferring. Experiencing dyspnea while ascending stairs. Occasionally feeling lightheaded or exhausted after you have up. Mental exhaustion may additionally strike some human beings. Lack of appetite, and basic lack of pressure to move. These are regular signs of a slowed muscle metabolism. Bone frequently has a considerable role. What causes bone deficiency inside the aged? There are some of reasons. One is a reduction in absorption. Our digestive structure's capability to absorb thiamine from meals declines with age. 2. The second is the use of medicinal drugs, diuretics, which can be regularly prescribed for coronary heart problems or high blood pressure, purpose bone to be flushed out via urine. Antibiotics and metformin may additionally potentially have an effect on bone levels. 3. Consuming booze. Seniors' capability to soak up bone can be hampered through even modest intake of common alcohol, along with wine or beer. Fourth, a terrible diet. Bone is removed from loads of processed meals. Additionally, your intake may be too low in case you're ingesting less entire grains or legumes. What is the conclusion of the research? Tokyo University Study 2021. More than 30% of the 300 older individuals in the research had negative bone tears. Additionally, these people had some distance, much less leg strength, moved extra slowly, and often complained of muscle weariness. Most established a substantial boom in electricity on foot distance and stair hiking following bone dietary supplements. Research, Neurological Sciences Journal. Every day, sufferers with persistent leg fatigue received 100 mg of thiamine. 82% reported progressed patients after 7 days. 68% suggested much less heaviness and leg pain. There were no detrimental effects. In what approaches does bone guide your legs? The Krebs cycle, your body's #1 electricity-producing mechanism, is powered by vitamin bone. This makes it feasible for your muscle cells to provide ATP more unexpectedly, recover from motion's greater speedy, and preserve their energy and tone in the course of the day. Additionally, bone enables the switch of nerve indicators, especially inside the peripheral nerves that govern your legs and FT. It's like attempting to function a car without petrol when you do not have bone. Nothing actions, but the whole lot features. What is the required amount of bone? Simply 1.2 milligrams according to day for guys and 1.1 milligrams in keeping with day for women is the cautioned dose. However, notably large doses are often applied for therapeutic benefit in older folks with symptoms. Doctors frequently recommend seniors who have nerve issues, tiredness, or leg weak point to take 50 to 100 milligrams every day. The proper news: when you consider that bone dissolves in water, surplus may be effectively removed by means of urine. When and the way is the first class time to take it. Consume bone within the morning to help expanded strength degrees during the day. It need to always be interested by food, preferably one that contains some wholesome fat or protein. Don't take it with alcohol, espresso, or black tea. These may additionally obstruct absorption. Can bones be obtained by means of weight loss plan? Sure, however, you must be deliberate. Whole grains like brown rice or oats, legumes like beans and lentils, sunflower seeds, and organ and pig meats are extraordinary assets of bone. The majority of seniors, do no longer eat enough of these ingredients on a each-day basis, and positive diseases or tablets prevent absorption. Therefore, a complement can be a higher choice if you're uncertain or have lately skilled uncommon fatigue. Who should consider supplements? Who ought to reflect on consideration on taking bone dietary supplements? Your bone stages must be checked or clearly restored with a secure day-by-day dose if you have type 2 diabetes. Consume alcohol regularly. Take diuretics, metformin, or acid-blocking pills. Revel in leg weariness despite mild exertion. Is it secure? Certainly, even at large dosages, thiamine A is known to be secure and is regarded as one of the most secure supplements for senior residents. However, before starting high-doses bone, usually with your medical doctor in case you are on medicine or have liver or kidney problems. Actual results: many seniors record feeling greater energized after simply 3 or 5 days of taking bone. It feels lighter on the legs, it receives clean to stroll, it is less taxing to climb stairs, and the need to be lively and move comes returned naturally. Adding gas to an engine that has been sputtering for years is similar to that. Last phrases: Diet B may not be a showstopper. Compared to D3 or B12, it gets less interest. However, it may be the essential aspect that makes all the difference for those who are experiencing electricity problems, muscle weariness, or leg heaviness. Your muscle tissue are powered by way of it. Your pressure is restored. Additionally, it offers you the strength, purpose, and ease to undergo the day. Don't ignore bone in case you experience exhausted, overwhelm, or disengage out of your frame. The best vitamins can every so often have the finest impact. Combining the 3 vitamins. How can these 3 nutrients be combined to get the excellent results? Now, which you are privy to the diverse ways that vitamin D3, nutrition B12, and bone help your muscles, the next difficulty is: how will you integrate these nutrients for ultimate gain? Timing and ease are key to the solution. Let's start with the aid of discussing while to take every diet. The gold standard time to take Diet D3 is within the morning, straight away following breakfast, specifically if it includes a healthy fats-rich meal like yogurt, eggs, or a little quantity of avocado. Why? D3 requires fat for effective absorption because it's miles fat-soluble. Vitamin B12 is handiest within the early afternoon or round noon. Since B12 also promotes alertness, taking it too past due may additionally cause sleep disturbances. Do not take it with tea or coffee. These liquids may hinder absorption. Your morning gasoline is nutrition. B. Consume it together with your first meal of the day, ideally a wholesome breakfast that includes whole grains and some protein. It will help your power levels all day long and even assist you attention higher. Here's a simple regular illustration. Breakfast: a small bowl of Greek yogurt, 1 boiled egg, 1 vitamin D3 pill, and 1 diet bone tablet. Lunch: steamed vegetables, grilled salmon or tofu, and 1 nutrition B12 pill or lozenge. With this configuration, your frame receives the right vitamins inside the right amounts at the proper times. How about taking a multivitamin? Carefully study the label in case you presently take a multivitamin because many senior formulation underdose these vital vitamins. Be sure it has the right portions of bone, B12, and D3. Additionally, bear in thoughts that sure multivitamins consist of nutrients which are soluble in water and people which might be soluble in fat. Therefore, it's far still endorsed to take them with food, preferably at lunch or within the morning, and by no means on an empty stomach. Finally, it's not usually better to have greater. Always seek advice from your physician or pharmacist and take drugs as prescribed, especially if you have a persistent infection or are taking medicinal drug. When taken as directed, these three vitamins feature as a well-oiled device to present your legs and your life again, its energy, stability, and vitality. Safety recommendation and cautions. While the use of nutrients, like every other instrument, vitamins are powerful at reviving fitness and vitality, but they must be applied carefully. Here are some vital safety precautions to consider while you head to the pharmacy, especially if you're over 60. 1. First, avoid raising the dosage through yourself. It wouldn't observe that more is constantly higher just due to the fact something is natural. You will now not get faster outcomes in case you take twice or 3 times the prescribed dose. In truth, it can also be harmful. For instance, nutrition D3 is soluble in fats. Over time, taking too much, 4 IU or more per day without supervision, can motivate your calcium tires to turn out to be too excessive. Kidney stones, constipation, nausea, or maybe disorientation can also end result from this. Second, be careful if you have renal or liver troubles. These organs are in charge of breaking down and disposing of extra vitamins from your frame. Even well-known dosages can acquire and bring about damaging effects if they are now not functioning properly. Therefore, earlier than beginning any supplements, specifically fats-soluble ones like D3, seek advice from your doctor when you have been diagnosed with persistent renal disorder, fatty liver, or every other critical sickness. Third, it's simple to miss positive detrimental effects of vitamins. For example, taking large quantities of diet B6 for months at a time may also result in tingling or numbness on your fingers and toes. Although it is uncommon, unmonitored misuse is especially likely to cause it long earlier than more serious issues show up. Too much vitamin D3 can produce headaches, cramping within the muscle tissues, or poor urge for food. Always hold an eye fixed out for any little adjustments to your mood, mainly if they occur after taking a brand new vitamin. Lastly, get your blood tiers measured. Doing a primary blood check each 6 to 12 months is a smart idea if you're taking D3 or B12 on a long-term basis. This helps make certain you are now not inadvertently taking too many or too few dietary supplements in which you're inside the secure and powerful variety. In conclusion, taking vitamins can certainly decorate your exceptional of existence. However, the secret is to be clever, knowledgeable, and careful, specifically as we age. These 3 clean nutrients have the energy to trade your strength, mobility, and independence whilst taken as directed. Let's assessment for a 2D. It's now not age, it's now not your imagination, and more notably, it is now not irreversible in case your legs were feeling unsteady, heavy, or weak. Lately, we've seen how Diet B12 improves your nerves and balance, vitamin D3 fortifies your bones and muscle mass, and Diet B12 replenishes your strength and stamina. These 3 basic nutrients paintings collectively to create a potent trio that will let you regain your electricity, confidence, and freedom of movement. Here's the secret. Even though, whether it's monitoring your blood degrees, taking a morning complement, or consulting your physician, you have to take the first step. Every time, motion is most efficient to waiting. I'd love to listen from you right now. Have any of these nutrients been attempted before? Did you be aware a trade in your standard energy, or stability? We get more potent collectively the extra we study from each other, so please proportion your story within the comments section. Please allow me understand where you are coming from nowadays. Before we begin, please sense free to invite any questions you may have and go away a remark underneath. Remember to click on the subscribe button and allow notifications so that you do not pass over any of Senior Health's pinnacle fitness advice. I respect you looking. Look after your frame, fuel your legs, and preserve going one effective stride at a time.